Good afternoon, Framingham families and residents. I'm Mayor Yvonne Spicer, and I'm pleased to be here today with Dr. Sam Wong, Director of Public Health for the Framingham. Can we start again, please? Superintendent Bob Tremblay, for the Framingham Public Schools. We are broadcasting live from Framingham High School with the support from the Framingham Education Channel TV, and appreciate their flexibility to pull off this so quickly. If you watch the news and read the paper and check social media, the stories surrounding coronavirus or COVID-19 are increasing and changing by the day and sometimes by the hour. New information is constantly coming out, which presents a challenge in how we communicate with all of you. Several of us met this morning, and we wanted to share information through a video and hope that this reaches you where you are and shed some light, and as well as answer a number of questions.
I'm Dr. Sam Wong, Director of Public Health for Framingham. First, it is important to emphasize that at this point, the risk to the city relative to COVID-19 is low. City and school district leaders are in discussions and planning for a coordinated response in the event that the risk to the community increases. Plans will be developed in accordance to the latest guidance from my office, the Framingham Board of Health, Massachusetts Department of Public Health, and the Centers for Disease Control and Prevention.
My name is Bob Tremblay. I'm Superintendent of Schools. We are pursuing the translation of this video, and we'll get this out to all families as quickly as possible. As a community, we are working closely with our partners at the city and state levels, both experts in public health and also in public education. This morning's meeting included members of our district senior leadership team, and we wanted to share several updates with regards to buildings and grounds, food services, human resources, and more. From a facilities standpoint, all touch surfaces are cleaned nightly in each school. Examples of touch surfaces include doorknobs, push plates on doors, water fountains, student desks and chairs, telephone handsets, bathrooms, and medical areas. We also have a Clorox 360 tool, which is an electrostatic sprayer that delivers trusted Clorox solutions to the front, back, and sides of surfaces. Provided cleaning supplies to the transportation department for nightly disinfecting of the Framingham public school buses. Our Buildings and Grounds Department is beginning to provide teachers with disinfectant material for the Chromebooks. Our food service team is also going above and beyond with cleaning, the washing and sanitizing of all food service areas in between meal times, including service areas, pin pads where students enter their IDs, and the tables. We will also put together a list of food pantries and providers if there is a school closure. We will then be prepared to direct people to those resources. Following the governor's direction, we have canceled all international trips for the remainder of the school year. Following the Framingham Health Department's guidance, we are going forward with our plans for local and in-country domestic trips. We will continue to hold Framingham Public School gatherings as well, including concerts, sporting events. If and when the state and local boards of health change their guidance related to these events, we will follow that guidance and update you accordingly. If you're a staff member and have any questions or concerns about the use of sick days, please contact Ina London at the Office of Human Resources. We've heard many questions about school closure based on news and updates from surrounding towns. Again, we are monitoring the situation very closely and will be sure to update the community if this is something we need to consider. Regarding school closures and the 180-day requirement, the Department of Elementary and Secondary Education, or the DESE, has reiterated the following guidance. All days lost to health, weather, or safety emergencies between the first day of the school year and March 31st must be made up by rescheduling full school days to ensure a 180-day school year. All days lost to health, weather, or safety emergencies between April 1st and June 1st must be made up to ensure a 180-day school year or until the district has reached its previously scheduled 185th day, whichever comes first. If all 5 snow days have been used prior to this point, the district is not required to schedule additional school days. Districts will not be expected to make up any days lost to health, weather, or safety emergencies that occur after June 1st. The DESE will revisit this guidance if the situation warrants it.
Anyone experiencing symptoms, fever, cough, and shortness of breath should contact your primary care provider or other medical providers. If you do not have these symptoms, but you have concern over known or possible exposure, please contact the Massachusetts Department of Public Health at 617-983-6800. As a matter of practice, if or when there is a suspected case, presumptive positive, or a diagnosis, that person is quarantined and immediate household members are also quarantined. Anyone who's had direct contact with a suspected case, presumptive positive, or diagnosis in the last 14 days also needs to be quarantined. There are some everyday precautions you can do to help avoid the spread of respiratory viruses like the flu and COVID-19. Avoid close contact with people who are sick. Wash your hands often with soap and warm water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing, or have been in a public place. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol.
To the extent possible, avoid touching high-touch surface areas in public places, elevator buttons, door handles, handrails, handshaking with people, etc. Use a tissue or your sleeve to cover your hand or finger if you must touch something. Wash your hands after touching surfaces in public places. Avoid touching your face, nose, eyes, etc. Clean and disinfect your home to remove germs. Practice routine cleaning of frequently touched surfaces, for example, tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, and cell phones. Avoid crowds, especially poorly ventilated spaces. Your risk of exposure to respiratory viruses like COVID-19 may increase in crowded, closed-in settings with little air circulation if there are people in the crowd who are sick. For more information about COVID-19, please go to the Massachusetts Department of Public Health or the Center for Disease Control, or the website. Framingham will also be providing regular updates on the city's website and social media channels. If you haven't done so already, please sign up for the city's Reverse 911 program on the front page of the city website and to receive emergency alerts.
I want to reassure you that in all of our decisions, we put the health and safety of our children and staff first. We are working closely with all relevant state and city departments to respond to this evolving situation. We have created a COVID-19 page on the Framingham Public Schools website, which will be updated regularly with information and guidance as we receive it. Thank you for watching, and please feel free to share this video with others in the community.
Thank you. I want to thank both Dr. Tremblay and Dr. Wong for being here, and on behalf of the City of Framingham, we will update you as things progress.